We have one more program before we break again. I hope I get this right. Dirigo, health reform from the state of Maine with Trish Riley and Carnley Harrington. If I got the name of the program right?
Well, it's debatable, but it's Dirigo.
Dirigo.
Good afternoon. Thank you very much for this opportunity to be here and share some information with you about Dirigo Health, which is Governor Baldacci's comprehensive reform of Maine's healthcare system. Dirigo's novelty lies in recognizing that it's not enough to invest funds to cover all our citizens unless we simultaneously work to reduce the spiral of healthcare costs and improve its quality. Maine is testing how we might address the American tragedy of 49 million people without healthcare coverage. The U.S. spends more than any other developed nation on healthcare, covers fewer people, and our health status is not as good. We rank 24th in health, just above Cyprus. And we have a significant problem with quality in the United States. Preventable medical errors cause more deaths than breast cancer. In short, we spend more and get less. In Maine with Dirigo Health, we've taken on the status quo to address the triple threats of cost, quality, and access to achieve, we hope, universal access to coverage. We created an independent agency of state government, the Dirigo Health Agency, to administer the Dirigo Choice Insurance Program and its Maine Quality Forum. Karen Lee is that agency's executive director and is here to answer questions. Dirigo Choice Insurance, one part of our reform, is available to Maine's small businesses, sole proprietors, and individuals through a public-private collaboration between the state and Anthem. Most uninsured work in small firms, and they have incomes below 300% of the federal poverty level. Dirigo Choice builds on the current private employer-based system and integrates the Medicaid program with the employer plan. By marrying the two, our goal is to expand employer coverage to all, including the very lowest wage workers. Dirigo Choice provides discounts on monthly coverage costs and deductibles based on ability to pay, and offers a unique and comprehensive benefit that focuses on prevention. The Healthy Maine Reward Program encourages people to select and use a physician, not an emergency room. The Maine Quality Forum brings healthcare providers and consumers together to assure the problems of medical errors are addressed and that costly, inappropriate variability in the delivery of healthcare is moderated. Presently, the Maine Quality Forum is launching a Safety Star program to identify Maine hospitals who meet standards of safety. The governor established a focal point for health reform in his office. We've created a state health plan designed humbly to make Maine the healthiest state in the nation and to take on the long-term job of reducing rates of chronic illness and improving the efficiency of our healthcare system. To inform that effort, we undertook a robust community engagement process, assisted by our university system, randomly selecting Maine citizens to join us in all-day forums we called Tough Choices in Healthcare. We've taken on more direct cost containment initiatives as well, including a system of voluntary cost constraints in Maine's hospitals, insurance premium rate regulation, increased transparency, and a budget to govern the investments in expensive new technology and capital equipment. As with any program to expand access to coverage, funding is the hot button issue. Importantly, Dirigo Health is so committed to bringing down the spiral of healthcare costs for all payers that it links savings in the healthcare system with the financing of the Dirigo Choice program. We are seeing results. Over 16,000 people have been served by the program since Dirigo opened its doors. Prices of common procedures are now posted in hospitals and doctors' office. Measurable reductions in the overall cost of healthcare of $44 million has been documented in 1 year. Health InfoNet, a new nonprofit, is securing funds to build an electronic medical record superhighway for our state to connect hospital to hospital. Over 2,000 Maine small businesses are part of Dirigo, joining a large pool to negotiate for better prices and allowing individuals to buy into a small group plan at much less cost. Dirigo Health is very much a work in progress, and the promise of the reforms will not be fully realized overnight. It is a hard fight and a difficult one for a single state, but we are heartened by Massachusetts' recent enactment of reform that mirrors Dirigo and goes beyond. Congress has often taken on health reform only after states have shown the way. Congress enacted the State Children's Health Insurance Program, HIPAA, even drugs for the elderly, only after the majority of the states had enacted and shown similar programs. We think each state must provide a critical role as a laboratory of innovation and health reform to inform national discussion. And we hope that Dirigo can be at least one small example. We are very honored to be here, and thank you very much for the opportunity.
Lee Short.
I want to understand the relationship between what you're doing in Maine and what has happened in Massachusetts. You say that Massachusetts has gone beyond what Maine has done, but as I understand it, only in numbers of people covered, whereas you've gone beyond Massachusetts in dealing with both cost and quality issues. Is that correct? And could you talk a little bit about why you think that's an important aspect of what you've done?
That is correct. What Massachusetts went beyond, it is a coverage initiative and not the full cost, quality, and access. They created some mandates that will go into effect in the years ahead, an individual mandate and a quasi-employer mandate requiring employers who don't provide coverage to make a nominal payment. But they don't talk about the whole system reform. We believe that you can only make insurance accessible even for those of us who have it, who are watching costs grow, if you address quality and cost containment. The variability in healthcare, the medical errors, the kinds of problems in our healthcare system need to be addressed systemically in order to really redirect our system. I think the stunning fact that our healthcare status is so poor in this country compared to other developed nations, we spend so much and yet people don't have coverage, suggests that there's a very, very real need to reform our whole system, and the Dirigo health reform tries to do that.
David?
What you're doing is incredibly important, and I applaud you. The history of similar efforts is pretty discouraging. You may remember when Mike Dukakis was governor, he passed a big health reform initiative that was going to provide universal coverage, and we then went into recession, had a fiscal crisis, couldn't afford it, and repealed it. Tennessee passed TennCare in the 90s, which was a very large expansion. They've cut it way back in this latest fiscal crisis. What's going to keep you from hitting the same wall when we have the next recession and your state is $2 billion in the red?
We've actually already hit some of those walls, and we feel them. We finance this program not from general funds for that reason. The finance of the program is an assessment on insurers and self-insured companies, not uncontroversial, after we prove independently through the superintendent of insurance that there are savings in the system, that cost growth has come down. That's obviously the subject of debate and discussion. And I would argue that while TennCare and Massachusetts certainly hit their own walls, they still exist. And in fact, the uncompensated care pool in Massachusetts was the platform upon which this new reform was built. So while I'd argue that ultimately we need a national solution, if the states keep pushing and keeping the door open, I think it continues the discussion at least.
I have a question, maybe Karen Lee, I don't mean to pick on you. I think you're very aggressive in trying to address all aspects of the healthcare industry, access and cost, and quality at the same time, but also understand that not all of the industry has accepted this with joy, and you've got a major litigation overhang, and one of the issues we look at is sustainability. If that litigation does not go your way, how confident are you that you'll have enough left in the program to continue and make some? All right, well, Karen Lee.
I think the litigation is real, and I think we've just created a Blue Ribbon Commission in the event. We're very confident that we'll win, but we've created a Blue Ribbon Commission to look at other kind of funding sources. And I think one of the important lessons of our program that I think is important to any future reform is we started right away, despite all the trouble and all the controversy. We now have enough people enrolled that there's a compelling political reason to keep this program going and to find other solutions. So I think the combination of the importance of the program, the people it's serving, and this Blue Ribbon Commission to look at alternatives in the event that we're unsuccessful in the courts will succeed.
And forgive me, I don't know if I can follow up.
Please.
Is the litigation just on that one element, and is the legislation severable, so that if, God forbid, they succeed, do they just strike down that portion of the legislation that they object to, or would it knock the whole thing down?
I think one of the things that's really important to keep in mind is that those that oppose or are in litigation with the agency have said and have demonstrated on a number of occasions that they support the overall goals of the program. The issue is the financing and how we can come together to figure out long-term sustainability around the financing is really the heart of the litigation. So I think it's promising that we have the support of the Maine State Chamber, we have the support of the insurance industry relative to the broader goals. The challenge is around the financing.
And the